if we use the monitors and anesthesia care, the patient still take some potential complication, such as airway obstruction or hypoxia, hypercapnia. So if it happens, the patient have to convert to the general anesthesia. It means we need to do the intubation immediately. So I think it's very dangerous for the patient if this kind, if it happens. Others including hypertension, cardio ischemia. If the dosage of sedative drug is not enough, the patient may move their leg when we doing the surgery. And we have wait for the patient, they can breathe spontaneous or speaking or stable hemodynamics at the surgery. So the patient have to stay in the recovery room for a couple of hours. So if we use the tumors and anesthesias only, because patient's conscious is clear, so the patient can talk to us or just listen to the music if they want to talk, or just take a risk. And this is the photo in our operation room, so you can see patient can walk immediately when they get off the table after the surgery. So patient can walk home immediately, or they can go to the work in the evening because we do the surgery in the morning, or even go shopping, something like that. And how to do it? I think the most important thing is this four key points. And the first one is we have to good tumescent injection technique. Tumescent anesthesias are very cost-effective, easy, fast, and very safe. So as we all know the anatomy of Egyptian eyes, so we have to inject the tumescent fluid into the saphenous compartment. So you can see the picture. We can see a concentric circle in the transverse view by the echo here. Good tumors and anesthesias can providing anesthesias. Besides, it can facilitating contact with vein wall, deepen the vein from the skin, or use as a heat sink. So this is a video here. So we can see the needle was into the right place, and as you can see, the saphenous vein was compressed by the tumors and anesthesias. From this study, Phlebology 2015, thermal ablation of saphenous vein is feasible and safe in patients even older than 75 years. In this study, around 91% patients are used only tumors and anesthesias only. Let's take a look at the parasthesias. The tumors and anesthesias was just 2.2% complication compared to the general anesthesias, it's around 12%. And the next is about the ultrasound. Ultrasound can be used in the pre-operation, evaluation, diagnosis, intraoperative puncture, tumors injection. We can make sure the tip position, and we can use in the sclerotherapy, and last the post-operative follow-up. The next is the sclerotherapy. It's very simple and without wound or pain with good effect. According to the guideline here, we recommend that liquid or foam sclerotherapy are good for the telangiectasias, reticular vein, or the varicose vein with 1B level of evidence. So this is the consensus from for sclerotherapy. It's from the dermatology surgery. He had recommended the concentrations used for the reticular vein or telangiectasias, or even the guidelines for compression. Another consensus from European meeting on foam therapy. So as you can see, about the indication is that all vein sizes are suitable for foam sclerotherapy. Of course, there are some adverse reactions of sclerotherapy, such as extravasation related ulceration or something like matting or hyperpigmentation. So the sclerotherapy was recommended use in the adjuvant treatment of tributary following trunk thermal ablation. Can be used in the recurrent varicose vein, in the elderly or frail patients with venous ulcer. Can be used in the C1 levels case. And last but not least, we need a good nurse and doctor care. From this study, the patient was under the varicose vein treatment and with only use the local anesthesias. They divided the patient into 4 groups. First one is control group, and let the patient listen to the music or watching DVD or just talk to the nurse. The conclusion is that the nurse played a very important role in improving patients' experience during the surgery. This is another paper, the same, divided patient into 5 groups. The conclusion is that we use just the simple intraoperative distraction technique, such as interaction with nurse, or can significantly improve patient's experience. So we use the tumor cell local anesthesias with many pros or cons. So conclusion, thermal ablation with tumor cell anesthesias are very effective, feasible, and safe. Thank you very much.